So thank you very much for joining us today. Thank you so much and welcome to our Septodont webinar. Thank you all for attending today. Well, people from all over the world are joining us tonight. Well, tonight, Paris time, of course, but all over the world today. So we're very glad to have so many people on track with us. So today I want to give a very warm welcome to Michelle Meredith, who's our guest speaker. And Michelle, you're joining us from Liverpool in the UK, right?
I am, yes, in Liverpool. Still celebrating England's win last night.
Well, it's a hell of a coincidence, and I think it's very good. So I'm guessing that you're very good today?
Yes, in a very good mood, hence the glow.
So our presenter, Michelle, you have more than 30 years of experience in dentistry. You've played an instrumental role in improving the dental infection control and prevention in both general and community dental practices. You've delivered audit and training programs. You've spoken at national IPS conferences. And you've participated in, Dentistry Magazine Study Club's COVID webinar series. Very up to date. You're currently now an independent practitioner and you're specialized in dental infection control. We're very glad to have you today on this subject, and thank you again for joining us. Some logistical information about this session for you attendees. Well, your microphones are on mute, as you already know. It will remain like this throughout the whole session. Please do not hesitate to ask questions. You have a dedicated box in the area of the control panel. Your questions will be answered at the end of the session of the lecture, so please stay tuned with us. There will be about 15 minutes presentation by Michelle, and then we'll have a Q&A session. Also, just so you know, the webinar will be recorded today, and we will post it, and you will receive the link later on to the link to the replay. But first, I wanted to start with a couple of questions for you, our attendees. And just before Michelle talks us through how important this safe needle theme is today, well, let's talk about needle stick injuries and ask you a few questions. Just so you know, I think that Michelle's webcam has a little bit of issues today, still celebrating England's winning last night, but I think that we can still hear your audio. Michelle, you're still here, right? I'm
still with you, yes.
Okay, so we'll just do the polls and hope that Michelle's camera comes back to us. So here you go. You should see on your screen a poll in progress. Do not hesitate to participate in it. So we want to know basically if you or someone in your entourage has already sustained a needle stick injury. The difference, the separation in between the yes answers is very important to us, and we'll explain it to you afterwards. So I'm giving it, it's been 30 seconds, I'm giving it a little bit more time. Do not hesitate to vote, come on. Numbers are tied. Ooh, numbers are tied. Still, some of you haven't voted yet. I'll close in 10 seconds. Okay, so let's close it. Thank you for your answers. I will share the results now with you. So we do have a majority of people saying they haven't sustained a needle stick injury, which is really good, but of course, hopefully not, but it can still happen. And Michelle, maybe you want to talk about the distinction that we did before for the yeses.
we were going to do just a simple yes or no, but obviously with COVID hitting globally, and I know a lot of the practices closed down and different things, that we thought we'd extend one of them for in the past 2 years. And also because of the European guidance as well, where we had to be compliant with ensuring we used safer sharps and things like that. I would have liked maybe longer to sort of go into a needle stick injury and a sharps injury, because maybe needle stick injuries are reducing and sharps injuries maybe are plateauing as people are starting to move over. So, you know, but we had a look at the past 2 years, so that's really good. If it's, you know, there's only 13% in the last 2 years, is that because they're using safer sharps and needle stick injuries? And you can see there was 41% before the 2 years. Is that basically because the numbers are down that we're seeing patients, or because you've introduced safer sharps into your practices? So there's lots of discussion within your surgeries about that question, and ones that maybe if we had longer we could sort of really delve into and discuss.
Yeah, but basically, thank you very much for like bridging to the next question, because because we have another poll for you guys. So I'll just run it. Thank you for answering. And now there's a second poll. So obviously you are mostly dentists and dental nurses in the attendance, but a lot of you work for dental practices. So do you or your dentist currently use a safety injection device? Ooh, it's already the numbers are going up. I'm giving it a little bit more time. Oh, the yes and the no's are starting to equalize. 10 more seconds. Please vote. Okay, I'm closing it in a second. Thank you, everyone, for voting. So if I share the results now. Ooh, we do have a 55% of people using a safety injection device. It's very good. Michelle, care to comment?
Yeah, that's really good. It's really heartwarming as someone who sort of is around like safer sharps to see. Again, I'd like more time to sort of delve into them yes results and see is it a safety injection device, not the the aim safe that some people use, where they're still sort of fishing around to get into the aim safe. That's not really classed as a safety injection device. But that's really good. The 55% are even aware of what the safety injection devices are. 45%, I'm still a little bit that they're not using a safer injection device. And the reasoning behind that, what would be their reasons behind not currently using one? Is it just because financial maybe, they don't see a need? And how many of them have actually done the risk assessments against sort of why they haven't moved over to a safety injection device? So again, lots of discussions around the polls, but it's really good to see that the 55% could. Let's hope we can sort of start pushing it even higher. Hopefully once you've listened to the webinar, it might change your mind.
We can only hope. Yes, crossing fingers. Thank you very much. Thank you very much to our attendees for participating in those polls. Thank you, Michelle, for commenting. And of course, it's there for a purpose. And of course, it's to help us go into the next part, which is obviously our webinar. So next thing, we are going to move on to our guest presentation. It was previously recorded, so you will see a change of scenery. But we will be back in about 15 minutes to take the Q&A. Well, sit back, relax, and enjoy the lecture. See you in a bit, and don't hesitate to ask questions through the dedicated area in the control panel. Okay, I will show that presentation now.
Needle safety, what's the point? So who am I, and why have I been asked to deliver this webinar? I've worked in dentistry for over 30 years as a dental nurse. I've worked within general dentistry, community dental, orthodontics, infection control, and management. For the past 20-odd years, I have had an interest in infection control, and this highlighted my interest in safer needles and reducing sharps injuries in dental practices. I'm honoured today that Septodont have allowed me the opportunity to play a small part through my personal experiences to deliver this webinar. Today, we will briefly look at how syringes have developed and improved over the years, understand what impacts needle stick injuries have, and discuss the responsibilities practices have to ensure staff safety. So let's look at what we work with day in and day out, and what we take for granted every day of our working lives. The first image shows us a basic needle with the point end where the bevel is located, and this is injected into the patient. At the other end, the butt end is inserted into the solution or anaesthetic, and in the middle is the hub. From the point end to the hub is known as the effective needle length, and as we know, our needles come in various lengths and gauges. On the second image, which is of a dentist's traditional metal syringe, there are 8 components. The thread being number 1, followed by the harpoon, which can be different with an aspirating syringe. Then the piston and the barrel, the finger grip, the finger bar and the thumb ring, closely followed by number 8, the plastic cover on the actual needle. So why am I going through all this with you? Well, I wanted to emphasise the many different components that go into making a safe, reliable product that's fit for purpose. I was lucky enough to see firsthand the workmanship that goes into making just one of these safer devices. The earliest records in Greek and modern literature show us that syringes were used, but their medicinal use was first documented in 1650. You can see from these pictures, the design has not changed too much, but some of the components have. We have a cartridge built in picture number 2. We have the metal syringe that was introduced in the 1950s. And we now have plastic, autoclavable and disposable syringes. So why do we need to move to safer needles? With the emergence of HIV in the 1980s and other bloodborne viruses, this was pushed into the forefront of the media hype. As a profession, we deal with bodily fluids daily and with each patient. Initially, patients with bloodborne viruses were treated in specialist clinics and booked into certain slots within the day's diary. But the Care Quality Commission, the General Dental Council, and the issuing of the Equality Act wanted our profession to treat all patients with no prejudice. And with a rising number of patients living with HIV, which is just over 200,000, and living with hepatitis B, just under 200,000, we did need to look at safer sharps. So safer needle groups and networks and unions all started to merge together in the late 90s and pushed the need for a structured national, international and global guidance. The World Health Organization recommended that by 2020, the transition to safer devices and the implementation of national policies should be in place. There is lots of information and guidance out there for each nation and each specialist area of work, whether it be hospital or primary care. It may seem that sometimes it's death by regulation for our profession, but it is all there to help and keep us safe. As you can see from the chart, the risk of recapping needles, the use of local anaesthetic, the washing of instruments and decontamination, but that's a whole new webinar, and sharps disposal are just 4 areas in which if we tackled, we could halve needle stick injuries. A recent study in the British Dental Journal showed that there is still significant problems out there, with over half of dental surgeries still using the traditional metal devices, which involves screwing in needles, which should be a thing of the past. There are still some reports of practices who have converted over to safer devices, but are still sustaining injuries. I feel that those who are still sustaining needle stick injuries need to look at a more structured training and education programme within their practice. When a needle stick injury occurs, and as a dental infection control nurse, I had to deal with the aftermath of this, and it is hard. The staff member will need support, and possibly the rest of the team will have to cover their job. Additional training may have to be delivered within the practice, also taking staff away from seeing patients. The staff member may need post-exposure prophylaxis and hospital appointments to be attended. And is this covered in their healthcare outside of the NHS? The median medical cost of a needle stick injury is about $750 or £550 or €650. And this is not including any ongoing medical costs. Law firms regularly run advertising campaigns asking healthcare workers to contact them if they have sustained a needle stick injury in the past 2 years. Could your practice run the risk of litigation of a staff member going to one of these law firms? The emotional impact, obviously, on the person who sustained the injury is immense, but also on their family, support network, and colleagues. Does the person require further counselling, and who would fund that? No practice wants to get a reputation for not caring about staff safety, or wants the practice procedures investigated time and time again. Many years ago in my youth, our trust decided to move to a safer device. So we bought it, we read the instruction leaflet and dispatched it to our clinics. And our needle stick injuries rised. Why has this happened? We were asking ourselves. We've done the right thing. So off I went out to the sites, and upon investigation, staff were nervous around the new equipment. It was light, and some people loved to try and test the locking mechanism. It was amazing what weird and wonderful things people were trying to do with it. But we gathered all the constructive criticism from the staff, and off I went to France to see the needles being made and give my feedback directly to the company. I was warmly received, and I discussed at length our findings. The company also ensured our staff were fully trained in person to give them the confidence with the product. And lo and behold, our needle stick injuries reduced dramatically. allowing me to look at other sharps within the practices that could injure our staff. Ultra Safety Plus ensured all the early teething problems were removed by placing finger grips and a guaranteed locking mechanism. They have further wanted to improve this product and have now produced Ultra Safety Plus Twist. Ultra Safety Plus Twist is still in the same packaging and the same colour coding, so staff will not be confused. It also comes with a sterile disposable syringe, which come in boxes and are handy to have in if your handles are in the autoclave. Each box comes with a blue handle that is autoclavable. So you load the cartridge as normal. You get your new twist syringe. You pop it onto the syringe, onto the barrel, and you can actually see it twist onto the hub. So it's locked onto the hub. Using the finger grips, you will then pull it back, ready for use. Again, it's locked onto the hub, so it does not move. You remove your needle cover, and your dentist will use it. Then using the finger grips, your dentist will then place in the holding position, and it will be placed down. Once your dentist has finished using it, they can lock it using the audible locking sound, and you can hear it, and it's ready to be disposed of. And it just twists off. That bit goes into the autoclave, and that bit goes into the sharps bin. So if you don't believe me and my personal experiences, have a look at the evidence that is out there, that safer devices do reduce needle stick injuries and reduce costs, and in the long run will save money. In 2001, within a UK dental school, this diagram shows that needle stick injuries were dramatically reduced down with the introduction of safer devices. Also in 2020, research showed that amongst healthcare workers in China, the burden of needle stick injuries was substantial. But with the introduction of safer needles and devices, it reduced down the costs. So we've looked at the what and the why. What we need to ask ourselves is, when can we achieve this? Has your practice implemented or even started to implement safer devices? Looking at needles, but also sutures and blades. Do you record staff vaccinations and level responses robustly enough? When a needle stick injury occurs within a practice or a clinic, you will need these to hand, and it will help with the treatment of the patient. Is there good training and education within your practice on handling, assembly, and the disposal of sharps, as well as the responsibilities of who does what? Are you ensuring that there is policies and procedures within the practice that are clear and readily available? Good reporting mechanisms and a no-blame culture in your practice. Don't let fear or reputation come into someone not reporting a needle stick injury. Do you have good links with occupational health departments for guidance and immediate attention when a needle stick injury occurs? Where would you send your staff member if they if they sustained a needle stick injury. Once these are ticked, or even partly ticked, your team will feel valued and appreciated for the risks that they take every day within your practice. Thank you for listening, and if you have any questions or further queries or need any further help, you can contact me on the email address on the screen. But remember, be safe, and not just around COVID, but with needle stick injuries and blood-borne viruses. They were there before COVID, and they'll still be there after COVID. Thank you.
So thank you so much for being here. Thank you. We really hope you enjoyed the lecture. We do have another short testimonial for you, just a little bit of a bonus. So Michelle, can you talk a little bit more about what we have next?
Yes, we've just got a couple of testimonials from staff, basically around needle stick injuries and what the effect it has on them, and you know, on the person, like I mentioned in the webinar, on the person, but also on other members within the team. You know, because we're dealing with blood and bodily fluids day in, day out, I think sometimes we maybe can become a little bit blasé. But it's, you know, afterwards when the person's maybe at home, or even the day after, you know, I've had an instance where a member of staff didn't report it at the time for fear that they would be deemed stupid for sustaining the sharps injury. So, you know, I just wanted to, you know, let staff know it happens, it does happen, we're human, we're not superhuman in dentistry. So yeah, these two testimonies pay tribute to that.
Yeah, and I think they're really quite compelling, and well, to hear from someone who's directly concerned, either from someone who sustained one or who had to see a colleague sustain one. So thank you very much. We'll play them now. Stay tuned. We'll be back in a minute.
A few years after qualifying as a dental nurse, whilst dismantling a local syringe, I got a needle stick injury. I felt stupid at first, I've done the process loads of times, but I knew I had to tell my dentist, who was very reassuring. We ensured we followed the first aid procedure, and also he located my personal file to get all my Hep B information. We also documented it in our accident book. It was then that I began to worry, as it was a used needle. Somebody had already checked the patient's medical history, and there was indication of a blood-borne virus. After a discussion with our occupational health team, it was advised that I attend, which I did. They gave me lots of information and reassurance and took some blood. Work gave me the rest of the day off, which was really a nice thing to do, as it was only later in the day that the shock actually set in. Thankfully, all has been okay since, and work have changed the process to try to ensure that it doesn't happen again. But I'll never forget the shock and worry I felt right after it happened.
My colleague, who I worked with for years, sustained a needle injury years ago, and whilst it didn't directly affect me, it really made me realise how dangerous our job can be. It affected the whole practice, as we all had to attend further training, and we were obviously worried for our colleague.
So what we've heard was very interesting, as you said earlier. The testimonials of someone who has sustained a needle stick injury, and as you said, they feel ashamed at first, so they don't want to share that information. But it's really important to get that straightened with the practice and with the staff. Thank you very much for getting these for us. We know that I'm seeing a few questions here. Don't hesitate to ask questions, but I think we do have a few questions to answer for our next session, the Q&A. Michelle, you've seen quite a lot of needle stick injuries in your career. Can you elaborate on the way that typically a needle stick injury occurs?
Yes, quite a lot of needle stick injuries occur when you're possibly dismantling it, and that's usually because you're aware that maybe your next patient is in. You're trying to, you're thinking about what you may need to get out for the next patient, and also trying to dismantle it. It has brought about, also whose responsibility and who puts it where. If you are working in a very busy clinic where you're with lots of different nurses each day, sometimes, I know myself when I've been dental nurse, and you work, different dentists work differently. So it's always a good idea to maybe ask the dentist at the beginning of the day, once I've assembled it, where do you want me to put it? Your dentist should be dismantling it, but I know different places do differently. But you do need to have them conversations around who is going to dismantle it and not just leave it on the side. There has been instances where the dentist has thought it's changed, the nurse has thought it's been used, and that's when confusion comes in. You do need to sort of strengthen your policy and procedure around needles and sharps within the practice. I'm aware I've frozen possibly on your screen. I haven't gone to sleep. I'm still wide awake in here.
Yeah, your camera can be a bit fussy sometimes. Sorry for our attendees.
It's probably just sick of looking at my face.
It's fine. We can still hear you. So yeah, you actually pinpointed that the roles and responsibilities are very important in a dental practice, and that you have to get that straightened forward just before starting to work. And all practices can be different.
Yes.
So it's it's quite a thing. I wanted to be a little more clear about. I mean, we talked about the consequences of a needle stick injury, but what are? I mean, you told us about the financial consequences, but there are also emotional impacts. Did you yourself have to accompany someone who's had a needle stick injury, or was it really impactful on as a colleague?
In my role within one of the local trusts, I was the dental infection control nurse. So when a needle stick occurred, they would contact me, and I would talk the member of staff through the policy and procedure. And good enough, our trust did offer a really good occupational health. And I was like, I will come and pick you up if need be. Do you need that, the support? Because you imagine you've got a mixture of emotions. The patient, you're worrying about what the patient, have they got anything? Do they even know? Sometimes patients don't even know if they've got a blood-borne virus. So, you have got to tread carefully, but also the staff member, as we've discussed, may feel silly, especially if they've been doing the job a long time. If they're working with a younger dentist, they may think I'm the more experienced here. So it's all about supporting them and saying it can happen to anybody. And I did accompany a couple of members of staff to occupational health. Obviously, I didn't go in with them, but they just needed somebody to guide them through until they've cleared their head, until they've got all the information, and it made them feel valued and appreciated within the profession, which and especially nowadays, I know it's all over the internet and the forums. A lot of our staff, dentists and nurses, were not feeling appreciated by Joe Public. So at least let's appreciate each other and help each other through this, because like I said at the end, blood-borne viruses are not going to go away. I know I said when COVID goes away, but it keeps coming back in a different form.
I was going to ask you, do you think what kind of impact has had COVID on you were mentioning it earlier?
Yeah, I personally feel like, and rightly so, when it first hit, you know, we did have to concentrate on COVID, and it, you know, it did sort of come out of the blue, even though in England we had to deal with swine flu a few years ago, so I was able to pull all the information on that. But I think we've sort of forgotten about everything else a little bit that we still need to keep on top of. So around needle sticks, safer sharps, that is still there. You know, COVID rates are coming down, but you know, we have to keep on top of our bread and butter, what we've always done. I would like to think, I think maybe that's why we've been quite, not lucky, but we've been fairly okay in dentistry. I'm talking in England here because we closed down quite quickly. But a lot of what we've implemented around COVID, and this is not a COVID webinar, but we've been doing for years. We've been doing PPE, lots of cleaning, and things like that. So I think it's just we've had to step up a little bit, and maybe we took our eye off the ball on other things. So it's all about trying to get back to some sort of semi-normal. And as I said in the webinar, the World Health Organization said 2020. Well, you know, we're past that now, but they had bigger fish to fry in 2020. So, you know, let's sort of go back to that, and let's see if we can start to make sure everything's strengthened back up.
Yeah, but we've seen that quite a lot of attendees here are already using a safety injection device, so it's going in the right way, at least as to what the World Health Organization has recommended. Have you seen yourself that there was a large increase? I know that you're the one showing and training with our safety device, but have you seen an increase of people adopting the devices, not only because they have to, but also because, well, it's safer, obviously?
It's safer, and you haven't got to, you know, the needles as well. You've got to buy, you know, the cartridges. You've got to buy the needles, and okay, you're buying, you know, a safer needle device, but it's also a bit cleaner and a bit slicker. I feel that that's how dentistry sort of gone, certainly since I started many moons ago.
But not from the very ancient ones you've shown.
I recently delivered some training in practice, and you know, I asked one of the dental nurses how old she was, and she was 19, and I was like, I've been dental nursing longer than what she's been alive. You know, and some of the weird and wonderful things we used to do when I was a trainee, it makes me feel quite nauseous now, thinking of things that I've assisted in. You know, the dentist only put gloves on when they were extracting a tooth, little things like that. So I'm a firm believer in you have to give yourself a pat on the back on how far we have come, and we have come a long way. But that's not to say we can afford to sit back and become complacent. Now we still have to move forward, and that's how come I'm glad about, you know, I know Ultra Safety Plus Twist. You know, it's been a long time coming, the twist part onto the hub, but you know, you listen. That's not that this is a hard sell, but that's what I like about the company, and that's how come I've used the Ultra Safety Plus for 20 years since you first introduced it to us. Because you've listened to the feedback and you've tried to take it on board and develop it. So yeah, I think we have got to sort of move forward with things, and we are. All you dental practices out there, give yourselves a pat on the back for how far we have come and getting through the past 18 months, because it's been a nightmare for everyone.
Yeah,
so don't take your eye off the ball.
So yeah, thank you very much. I think that might be the final words of the webinar. Don't take your eye off the ball. There's not only
don't take your eye off the ball on Sunday.
And on Sunday as well. There's COVID, but there's also still needle stick injuries. So yeah, we were very glad to see that so many of you are already using a safety device. But let's just make it a whole lot more in the next, hopefully the next few months, let's say the next few years. Thank you so much, Michelle, for being with us today. The camera hasn't been too fussy. Yeah, it was a pleasure having you, discussing with you. Thank you everyone for joining today. If you have, we have some very specific questions that we'll get back to you locally. And if you have any further question, or if you want to contact Michelle, she has given her contact details in the presentation. The replay webinar will be available in a very short time, in a couple of days. And I hope you have a good end of the day. And well, go England then.
Thank you.
Thank you. Thank you, everyone. Thank you.